Well, I think any surgeon or physician who does a procedure needs to be available for follow-up. And emergencies happen, things happen, and people need to be, able to be in touch. My first advice would be to call the surgeon who did your procedure and describe the problem and say, here's what's happening, what do I do? And most surgeons have availability after hours. They have pagers and answering services and so on, so they're available, particularly those who are doing procedures. If for some reason you can't reach your surgeon, I think it's probably the smartest thing to go to the local hospital and go to the emergency. Sometimes a walk-in clinic would be appropriate if it's something minor, like maybe you might be getting a rash from your antibiotic and you just want to check, see if you have an allergy, maybe get an antihistamine, so you want to see if the local walk-in clinic could handle that. But if you have something more serious or more worrisome, if you're experiencing pain and things are not what you would have expected from your instructions, I think you need to either see your surgeon or go to your nearest hospital and have things sorted out, because I think the wrong thing to do is to just stay home and say maybe it'll get better by morning, because sometimes it doesn't. And time is sometimes important in dealing with things. If you're getting an infection, for example, you should be on antibiotics right away. And waiting until tomorrow obviously would not be helpful. So I think people need to be clear as to what to expect after surgery, and that's part of the instructions we give them. And then if what you're experiencing is not part of that instruction, then things should be looked at.